Welcome to today's press briefing. We have with us from the Center for Health Protection head Dr. Chang Shok Kwan and from the Hospital Authority Chief Manager Dr. Gladys Kwan. The two doctors will give us the information about the situation in the HA and that of the cases. Dr. Kwan, we have 1,886 patients staying in hospitals. 265 of them are new cases. Those in isolation facilities, 506 of them are in isolation wards. 146 patients are in second-tier isolation wards. 609 patients in North Lantau Hong Kong Infection Control Center. There are 212 new cases. Yesterday, we have reported 7 cases of critical condition, 2 in a serious condition. For those staying in hospitals, 34 are in a critical condition and 22 in a serious condition. 9 critical cases are receiving treatment in ICU. Of the death cases, we have reported another 5 cases, including 4 males and 1 female, aged between 50 to 92. Only one has received 3 doses of a vaccination. These are the details. The first, a 50-year-old male. He lives with his family. He has nasal cancer and also tongue cancer. He has recovered. He has problems swallowing, so he is intubulated when he eats, and that he has also suffered from other illnesses, so his pulmonary function is rather weak. On the 11th of August, he suffered from shortness of breath. His heartbeat was very fast. His RAT was positive with a low CT value. When he was receiving treatment, he suffered from an acute cardiac arrest as well as renal failure. He passed away. He was not vaccinated. The other one is an 88-year-old male living with his family members. He's had a stroke and also suffered from dementia. On the 11th of August, he was sent to the A&E department because of shortness of breath. He had symptoms for a number of days. At that time, an RAT was done. It was positive with a low CT value. There were some complications because of his deteriorating heart condition and other conditions. He was prescribed with antiviral medication. His condition did not improve. He passed away yesterday. He has had 2 doses. The third case is a 90-year-old male. He suffered from chronic kidney disease. He's been on renal dialysis and also on palliative care. He also suffered from other diseases, say, for example, heart disease, arrhythmia, as well as hypertension. On the 21st of July, because of loss of appetite and a sore throat, he was sent to hospital. He was tested positive. He was prescribed with antiviral medication. His condition did not improve significantly. He has been receiving high dosage of oxygen. He passed away. He's had 2 doses. So these 3 patients have not completed their course of vaccination. The 4th case is an 82-year-old male who's had 3 doses. He suffered from a pulmonary obstruction. He's had a stroke, and he's suffering from stomach cancer. He's been on palliative care. And at end of July, he was sent to hospital. His condition improved after being prescribed with antiviral medication. His condition stabilized. The PCR test was negative, so he was sent home. On the 14th of August, because of hemorrhaging in his stomach, he was sent to the A&E department. At that time, the PCR was negative. His condition continued to deteriorate. We think that this case has no direct correlation with COVID. He's had 3 doses. The last one is a 92-year-old female with 2 doses. She suffered from uh, heart problems as well as hypertension. She has some phlegms and she was coughing, so she went to hospital. He was prescribed with medication. She was tested with a CT value over 30. She's been discharged. A week afterwards, it was found that she lost consciousness when she was eating. When she was sent to hospital, that there was no signs of life. The case was sent to the coroners. We believe that this case may not have a direct correlation with COVID-19. In the past day, there are 248 patients that have recovered. 206 of them have been discharged. 4 patients were found to be positive upon admission screening. 8 patients in the same ward were classified as close contacts. In terms of staff members, we have 120 staff members that are positive. 25 staff members have resumed duty. We reported to you about an increasing number of elderly people being admitted. We'd like to take this opportunity to tell you that for public hospitals, we have adopted different initiatives to reduce the infection risk of elderly people in care homes and also our support. Starting from the 9th of July, we have enhanced screening arrangements, the testing arrangements for patients who are to be discharged to go back to care home. We will conduct a clinical assessment. When the condition is stable, we will do a PCR. If the CT value is more than 30, that means the case is not infectious. It's only under this condition that the patient will be sent back to the care home. This arrangement is to ensure that there is a lower risk of cross-infection in care homes. If the CT value is lower than 30, we will not send the patient back to care homes. Our staff members will take into account the clinical condition, consider sending the case to a holding center, and to make sure that the case is not infectious before they're sent back to care homes. Well, from the end of June to now, there are 47 cases that have been sent to holding centers before they are sent back to care homes. For our community geriatric assessment unit, they provide outreach services and assessment services. They also provide a remote consultation service. Under the current government anti-infection control, relevant elderly people staying in care homes will have to be isolated somewhere else. If there are suspected cases of positive, we will provide support and advice to care home staff. And if we identify the cases that needs to go to the hospital for admission, we will make arrangements. So the community geriatric assessment unit has been in close contact with care homes, especially care homes with positive cases. Care homes can also liaise with the geriatric assessment unit for arrangements to be made. We're very concerned about the health condition of elderly people. We see that if they get infected, their condition may deteriorate rapidly. So we will try to minimize the risk of infection. We will also assist care homes to protect the residents. Just like the cases I've just outlined, I would like to remind you that if you have not completed the course of vaccination, please do so as soon as possible. I'd like to also give you information about a press report this morning. It's about a resident who suspected to be allowed to go back to care homes and as a result infected others. It's a female patient. In March, she was diagnosed positive. She has recovered. At the end of July, when she was admitted to hospital, it was because of fever and shortness of breath. On 3 occasions after having been admitted, we have conducted tests, and all these are negative results. So it's not an infectious case. We have assessed her condition and made arrangements for her to return to the care home. She was discharged on the 1st of August. The PCR test result was close to 38.4. For the subsequent 2 days, the PCR test results were negative. For this female resident, after she's gone back to the care home, her result, together with 22 other residents, are negative. So we would like to say that this case is no longer infectious. She's met all the discharge requirements, and she has not caused any infection in the care home. Our geriatric assessment unit has liaised with the care home to find out more information about the actual situation. The conclusion they've reached is that everything has been done in a proper way. We'll continue to liaise with the care home to see what we can do to help them. That's all for my report today.
Good afternoon. The total number of positive cases yesterday was 5,811, including 2,184 PCR positive cases and 3,627 RAT positive confirmed with PCR tests. And we had 243 imported cases, including 212 PCR positives and 31 RAT positive cases. So like Dr. Guan said, we received 5 reports of death today. So far in the 5th wave, the total number of deaths is 9,376. Among the 243 imported cases, they include 121 positive test samples at the airport. During the first 3 days of hotel quarantine, as well as positive cases from quarantine centers, there are 51. Between the 4th and the 7th days, positive cases from quarantine centers and self-test at home are 50. Between the 8th and the 14th day, positive samples from a community testing center, there are 21. Most of the cases carry high city values, so are probably really positive cases. The cases are from 49 places, including 7 places having imported more than 7 cases. 31 from India, 27 from Thailand and the UK, 20 from the Philippines, 14 from Singapore, 13 from Japan, and 12 from Canada. The remaining 42 cases are from places with less than 10 cases. For care homes, today there are 6 care homes, including 4 elderly care homes and 2 care homes for people with disabilities with infections where close contacts have to be quarantined. Feng Wang elderly care home in Yao Chin Mong, 1 resident confirmed, 2 residents quarantined. Nga Yun in North Point, 1 resident and 2 staff members infected, 2 other residents quarantined. Sam Yao Gui elderly care home, 1 resident confirmed and 1 staff member infected, 3 residents quarantined. Christian Ling Sut elderly care home, 1 resident confirmed and 1 resident quarantined. Hong Kong Sin Do Hui Midway home, 1 resident confirmed and 4 residents quarantined. Hong Kong Psychiatric Society Lei Jiang Uk hostel, 4 residents infected, 1 resident infected and 4 residents quarantined. Now most schools are on holiday. Some schools are still having lessons. Today 36 schools have reported 48 positive cases, including 38 students and 10 teaching staff. They are from 26 kindergarten and childcare centers, 7 primary schools, 3 secondary schools. In the past 7 days, 5 schools have reported 2 or more cases. 2 schools are required to suspend some classes for 1 week. Fanling, Carfolk Estate, Baptist Church kindergarten class, a PM class, 28 students with 3 cases, suspension for 1 week. Hong Kong, Australia, International School in Kowloon City, class 6J, 25 students. 3 students have fallen ill successively, so suspension for 1 week. For variants, for subvariants, suspected BA.5 cases is on the rise. On the 15th of August, the percentage has risen to 27.2%, BA.2.12.2, 9%. It calls for attention, and those who are not vaccinated should get vaccinated promptly. Now, in terms of the age of cases, in the past week, the number of cases age below 3 accounts for 1.8% to 2%. Compared with mid-July, it was 1.2%. So again, a rising trend. For those under age of 3 years of age, previously vaccination was not available. Now they are eligible for vaccination, so they should get vaccinated promptly. Now we will open the floor for questions. Please raise your hands and use our microphone to ask questions, and please identify your media organization. The lady in the back. Good afternoon, doctors. I'm from Cable News. Dr. Zhang mentioned the trend of cases. There has been a rapid increase in the past few days. Today, the total number is over 6,000. So has the CHP assessed the reason behind the rapid rise of number of cases? Is it related to the recent relaxation of quarantine arrangements to 3+4, or is it related to major outbreaks? Concerning care homes, the HA has highlighted a case. Now, the resident has been categorized as a close contact after being sent back to the care home. So when the patient was admitted to the hospital in July, the patient had fever. So is that a repositive case, or is the patient unrelated with COVID? Now, the overall trend has never dipped. It has always been a gradual rising trend. Parts of the reasons may be the rising percentage of BA.5 cases. And many people are not vaccinated, and many are not have not caught the virus before, so they are not immune. So same for children and elderly people. And also, this is a new variant, and some people are not fully vaccinated, so there is no hybrid immunity for these people, and as a result, they are vulnerable. In terms of the care home mentioned by Dr. Kwan, at the end of July, the elderly resident was admitted to hospital because of fever. At the beginning, the CT value was quite high, but it was already 4 or 5 months since the patient was previously infected. So we treated the patient as a possible repositive patient. To play safe, we treated the patient as a new patient, and we quarantined her close contacts. So we have told the HA that we need to perform a few more checks to see if the patient was a new patient or a repositive one. In the end, we think it is more likely that the patient was a repositive patient. Now, I made a mistake just now. The patient was discharged on the 3rd of August. Now the CT value was 38.4. So on the 2nd and 3rd of August, we performed another PCR test for the patient, and they were all negative. So when we were alerted by the CHP, the elderly patient was still at hospital. So the arrangement was a cautious one. Thank you.
Let's take an English question. The person on the right.
RTHK, my question is for Dr. Guan. Can you talk a bit more about the discharge criteria for elderly patients who've recovered from COVID, and what will be done to ensure it's safe before they are released from hospitals and sent back to care homes? And seeing as there's an upward trend of elderly being hospitalized, is there any contingency plan in public hospitals? Thank you.
Okay, so I would like to speak on behalf of so to decrease the infections for the confirmed elderly who got admitted to the hospital, we have tried different measures. And starting from the 9th of July, we already enhanced the discharge surveillance. So when the confirmed patients who are ready to be discharged, our clinical team will do the clinical assessment to make sure that their conditions are fit. And if they fulfill the criteria, then we will arrange a PCR test for them. If the CT value is more than 30, that means they are not infectious. That's when we will discharge the patient back to the elderly home. And these measures will protect our patients as well as those stay in the OH home, because this would minimize the spread within the elderly home. If the patient have the CT value less than 30, we will not send back the patient to the elderly home. We will observe or assess their clinical condition to see whether they will be able to discharge to the holding center until they are not infectious before they are sending back to the elderly home as well. So since the 25th of June, there were already 47 patients discharged to the holding center before they were sent back to the elderly home. And besides our community geriatric assessment team, they always provide support to this elderly home, including the outreach service, as well as they will arrange the telecare for them to provide advice and input. So under the existing prevailing, the policy, and those confirmed cases who are staying in the elderly home has to be sent out for isolation. So if those elderly patients, for those who are confirmed or suspected case, who have to stay in the elderly home, our medical staff still will provide advice and see if there is any arrangement may be required if there is any emergency that require hospitalization. As mentioned, our community geriatric assessment team will continue to keep in touch with this elderly home or the residential care for the disabled patients. So they, of course, can contact our team as well if they have any issues. So this is the measure we are taking now. So we hope that with this, we're able to decrease the infection, especially among the elderly. But more importantly is we would like to remind those who haven't had the injection of the vaccine, especially the elderly and the high-risk patient, they should get the vaccination as soon as possible to protect themselves. And you've mentioned about the bed mobilizations. So we already are aware the situations is getting stringent, and of course there's pressure on the request of our bed arrangement. So we are now actually in our high-level command center. We will monitor the situation day by day, and as mentioned for the past few days, if the trend is keep increasing, there's a chance that those those not urgent services or non-essential service will have to stop. So because we still need to balance the need of those COVID patients as well as the non-COVID patient. So there is still we are still observing the trend to see how to handle these situations. So we don't have a fixed number, but we are observing this is going to be a critical for the coming weeks.
下一位有冇其他提問？
Next question. Any other questions? The lady at the back towards the left. I'm from Hong Kong Economic Times. I'd like to see clarification. Lei Fei talked about a patient that has been discharged. There are a number of close contacts. 3 of them have turned out to be positive. Is that really true? Are there any elderly patients that have left the hospital to go back to the care homes without any PCR negative proof? And you said that starting from a certain day, elderly patients might be sent to holding centers first. Apart from CT value higher than 30, what are the other criteria? Asymptomatic? And 47 people that have been sent to holding centers, have they gone back to care homes now? Are there any cases after they have gone back to care homes, their condition deteriorated? And any new cases in the 翡翠長者之間 that you mentioned yesterday? For the 22 patients, elderly patients, their PCR tests are all negative. However, for 3 patients, because of their own conditions, they have to be admitted to hospital to be properly taken care of. Apart from the CT value being over 30, and in particular for the case I mentioned, the CT value was 38, and the subsequent 2 PCR tests were negative. Our decision, we decided to send her back to the care home because we think that she's no longer infectious. In relation to whether the case will first go to holding centers, we'll see what the condition is and whether there are any complications, whether the patient require close monitoring before we decide to send the case to the holding center to wait for the CT value to go above 30 before they're allowed to go back to care homes. I don't have information as to the actual figure that patients are sent back to hospital from holding centers. For elderly people staying at hospitals or staying at care homes or holding center, sometimes out of caution, they are sent to hospitals for further checkup. I don't have the exact number with me. For J Elderly Home, there are no additional cases. Next, the gentleman on the right. I'm from TVB. First, the number of imported cases. Well, after the relaxation, we see about 50 cases that are identified after they've left the hotel. And just now, you said that 21 cases were picked up between the after the 8th day. Does it mean that the risk of transmission in the community has increased? You talk about an increasing number of cases. Have you conducted any analysis? For newly confirmed cases, are they all new cases? Are there any cases that have actually been infected back in February or March and reinfected again? We see the number of cases of BA4 or BA5 having increased. Do you think that before winter, BA.5 will become the prevalent subvariant in Hong Kong?
之後有個
For cases which emerge after the 8th day, if you have been listening to our reports, we do have some 20 cases each day with a high CT value, higher than 38, or at least about 30. So they are likely to be re-positive cases. Taking aside the re-positive cases. For cases detected during the 4th to 7th day at community testing centers, that is people with the amber code, the percentage is about 20% for them. Today, the percentage is 22%. The level is similar. That is in line with our estimation. The Secretary for Health said the cases detected on the 3rd day plus the cases detected at the airport accounts for 80%. So that is in line with his calculation. We also look at previously infected patients. Every day, 1 to 2% of the patients were infected back in March or April. Half of them seems to be re-positive cases because of the high city value. So they probably were negative on admission and then tested positive. So some 1% are these cases. The remaining 1% are likely to be new re-positive cases. So for BA.5, every day the number is on the rise. Judging by the current trend, according to the prediction made by the WHO and the situation in other places, it is likely to become the prevailing variant because of the high transmissibility. Now, the rising trend is very rapid, but the situation is yet to be seen. The gentleman over there. Good afternoon. I'm from AM 730. About discharge of patients back to care home. So how long do they stay in hospital, and how much will the discharge help the hospital situation? So what is the discharge criteria? When can patients be sent back home directly? So would you treat patients with a certain city value as recovered? Now, the staff member at Jade Elderly Home, the test was done on the 13th of August, but he was tested positive only on the 15th. So shouldn't he stay away from work in the interim? Yesterday, the secretary, the Health Bureau has called for help from the private sector. So how many patients are the private hospitals taking today? Now, for the weekly or the bi-weekly mandatory test, if the PCR tests are negative and they don't have symptoms, they should be allowed to go to work. Otherwise, it would pose operational problem. If the staff members have fever or other symptoms, despite testing or not, they should stay home. Now, for positive. For patients with positive results who are residents, if the city value is higher than 30, if they have a stable clinical condition and they are not infectious, they would be sent back to the care home. Concerning the private hospitals situation you mentioned, as of today, as at the 17th of August at 5 p.m., 115 patients are receiving treatments in private hospitals. Accumulatively, 299 patients have used private hospitals' beds. The last question, please. The lady on the left. I'm from Mingpao Daily. Now, how many inpatients are elderly people from care homes? On average, how long would they stay in hospitals? At present, BA.5 is becoming the prevailing variant. So would you revise the discharge criteria? If it is BA.5, will the threshold of threshold of 30 CT value be risky? Now, before bed mobilization is activated, would you send patients to isolation facilities like the Lantau Isolation Center? Now, BA.5 has a higher transmissibility, but the same likelihood of severe cases or death. And also, it doesn't affect the CT value and other parameters. For patients requiring hospitalization, some 10% of the inpatients are from care homes. Now, without referring to the actual data, on average, it should be 7 to 8 days for individual patients because of their existing illnesses that they may have to stay longer. Because elderly patients may need a longer period of rehabilitation because of hospitalization. I don't have the specific data concerning bed mobilization. The North Lantau Infection Control Center is a place for taking confirmed patients. So recently, the utilization rate has increased. We don't rule out the possibility of activating other isolation facilities. So the point is that we want to free up more beds. Still, we have to balance the need for non-urgent services. So every day we are monitoring the situation to achieve that balance and meet different patients' need. This is the end for the press briefing. Thank you.